Hello everyone, I am myself Dr. Rajesh Gubba. I am the general medicine educator. So in this particular section, I'll be discussing the new CPR guidelines. So these are published in the recent years by the American Heart Association. Now if you see the sequence of events that we need to do in the CPR, so previously it was airway breathing circulation, right? But now this has changed to CAB. What does the CAB stands for? So the word C is compression, and followed by that the airway, and this is followed by breathing. All right. So compression, airway, and then breathing. So this is the sequence in the CPR. Now, whenever you are doing these compressions, what should be the rate of compression? The rate of compression, it should be around 100 to 120 per minute. That should be the rate of compression. And what should be the compression depth? The depth of compression when we are doing CPR is different in adults, it is different in children, and it is different in infants. So if you see the compression depth in adults, so in adults the depth should be at least 2 inches, right? So this should be at least 2 inches. So in the sense it should be 5 centimeters. Okay, so the compression should be at least 2 inches. Maximum that you can go is up to 2.4 inches. Right? Maximum that you can go is up to 2.4 inches, which is equivalent to 6 centimeters. Right? So this is the compression depth in adults. Whereas if you observe in children, the compression depth should be nearly around 2 inches, which is around 5 centimeters. That is in children. Whereas in infants, right? Whereas in infants, the compression depth, it should be around 1.5 inches, which is around 4 centimeters. Right, which is around 4 centimeters. So this should be the compression depth depending upon the age group, that is adults, children, and infants. Adults it is like 2 inches, maximum 2.4. Children definitely it is 2 inches, and infants it is 1.5 inches. And once you've done a compression, what about the recoil? So if you see the chest recoil, you need to allow the complete recoil after each compression, right? So you need to allow the complete recoil after each compression, right? That is how the chest recoil should be. And what should be the minimum interruptions, right? Because whenever you're giving the chest compressions, intermittently you may require to give a shock also, depending upon the underlying clinical scenario. So, right, the pause, it should be less than 10 seconds. Right, pause should be less than 10 seconds. And this pause, whichever you are giving for less than 10 seconds, that is mainly to assess the rhythm, right, for rhythm check or for the delivery of the shock, right, or for the delivery of the shock. Okay, so this is the minimum interruptions that you need to give, that is less than 10 seconds. That is mainly for rhythm check or for the shock delivery. Now whenever you're giving compressions, parallelly you may also require to give ventilation as well. So what should be compression to ventilation ratio? So if you see the compression to the ventilation ratio without advanced airway, like again this compression to ventilation ratio is different in the adults and it is different in the children. Okay, so in case of adults, the compression to ventilation ratio, this is around, right, so this is around 30:2. Okay, whereas if you observe in the children or in case of the infants, right, in case of children or infants, like if suppose there are two rescuers, right, if suppose there are two rescuers, then in such case the compression to ventilation ratio the compression to ventilation ratio, it should be around 15:2. So this is in the scenario of without advanced airway. Okay, so without advanced airway, in case of adults it is around 30:2, whereas in children or infants with two rescuers it is around 15:2, right? Now if suppose the same compression to ventilation ratio with advanced airway, right, with advanced airway, so with advanced airway, continuous compressions, one, right, you need to give right, so you need to give continuous compressions, right, and one breath every 6 seconds. Okay, with advanced airway in the sense like where you have done a tracheostomy, so in such case the compressions should be continuous and you need to give one breath every 6 seconds with that advanced airway. So this is like without advanced airway, what should be the compression to ventilation ratio, and with advanced airway, like what should be the compressions and how much should be the breaths that has to be given, right? Now, and the another important thing in the CPR is the defibrillation. So now if it is suppose if it is a shockable rhythm, then you need to use AED, right, you need to use AED as soon as possible. Right, you need to use AED as soon as possible, right, and after you use this AED, resume the CPR immediately after the shock. Okay, resume the CPR immediately after the shock. All right, so this is about the defibrillation. Then what about the rescue breaths? So if you see this rescue breaths for apnea, right, for apnea is like where there is cessation of breath. So for apnea but with pulse, okay, for apnea but with pulse, one breath every 5 to 6 seconds in adults. Right, one breath every 5 to 6 seconds in adults, right, whereas one breath, right, one breath for every 3 to 5 seconds, right, for every 3 to 5 seconds in children or in the infants, right, in the children or in the infants. So this is like the rescue breaths that you need to give. So for apnea but with pulse, one breath every 5 to 6 seconds, and in case of children, one breath every 3 to 5 seconds, right? This is about the rescue breaths. Then followed by that, you take this advanced airway. So the advanced airways, we have the endotracheal tube and the other one is LMA. So the advanced airway, what is the recommendation is, you need to provide continuous compressions. Along with that, one breath every 6 seconds, right? One breath every 6 seconds. That means like 10 breaths per minute. So when the individual is on the advanced airway, you should not stop the compressions. So you need to provide continuous compressions. Right? You need to provide continuous compressions. Along with that, one breath has to be given. Right? One breath has to be given every 6 seconds. So which is equivalent to which is equivalent to 10 breaths per minute. So this is in advanced airway. And what about the use of the capnography? See, capnography is mainly for assessment of the levels of the carbon dioxide, right? So what should be the target EtCO2? Okay, so target endotracheal tube carbon dioxide EtCO2, it should be more than 10 millimeters of mercury. Now when the EtCO2 is like more than 10 millimeters of mercury, that indicates the effective CPR. Right? That indicates that you are giving the effective CPR. So the use of capnography is mainly to assess whether the CPR is effective or not. Right? Then what are the drugs that has to be administered? So the drugs that have to be administered are like number one, the epinephrine. So what is the dosage of the epinephrine? The dosage of the epinephrine, it should be around 1 milligram. And what is the route of administration of this epinephrine is either intravenous or the intraosseous. And this epinephrine 1 milligram intravenous or intraosseous, that has to be administered every 3 to 5 minutes. Right? It has to be administered every 3 to 5 minutes in the cardiac arrest. Right? In the cardiac arrest. So this is like the epinephrine administration. Okay, so this epinephrine administration is mainly to achieve the cardiac activity. And next is, for example, if the individual is in a state of VT or VF, along with the DC shock, we also need to administer, or we also need to give the amiodarone, right? That means after the DC shock and once the individual is hemodynamically stabilized, the drugs that you need to give is the amiodarone or lidocaine. But these drugs have to be given before the DC shock also, if the individual is hemodynamically stable. So hemodynamically stable VT or VT, we give antiarrhythmic drugs. If it is only hemodynamically unstable VT, that is when you need to give this amiodarone or the lidocaine. So this amiodarone or lidocaine, that has to be administered for right. So this has to be administered for the refractory VT, right, or VF, and you also need to administer this for pulseless VT. Right, pulseless VT. So these are the scenarios where you need to administer the amiodarone or lidocaine. So amiodarone or lidocaine, that is for refractory ventricular fibrillation or VT, then pulseless VT. And next is like in the post cardiac arrest state, what is the saturation that you need to maintain? The saturation that you need to maintain is 92 to 98%, right? And very important is you need to avoid hypoxemia. Okay, so very important is you need to avoid the hypoxemia. Okay, and at the same time you should also the saturation should be in between this 92 to 98, and at the same time you also should avoid hyperoxia. Increased oxygen also should be avoided. Then what should be the TTM, that is targeted temperature management. The targeted temperature management, this should be around 32 to 36 degrees centigrade, and this has to be maintained for nearly around 24 hours. So this is about the targeted temperature management, that is your TTM. So that is in the post cardiac arrest care, right? And now what about the role of the opioid, right? So for suppose if the individual is in a state of an opioid overdose, then in such case you need to administer the opioid antagonist, and where you need to administer naloxone, right? You need to administer naloxone. When will you administer naloxone? That is mainly if the opioid overdose is suspected, right? If at all, if you are suspecting. Okay, so if opioid overdose is suspected, that is when you need to administer naloxone. Okay, and if you take this hands-on only CPR, you need to encourage for lay persons if untrained or unable to give the rescue breaths. Okay, so this is mainly for lay persons. You need to encourage how to give the CPR, right? If they are untrained or unable to give rescue breaths, you need to encourage the lay persons, right? Now, some more the additional guidelines along with this is you need to emphasize high quality CPR. Right, so you need to emphasize the high quality CPR. This is like emphasized more rather than giving multiple drugs or placing the individual on the airway maneuver. Okay, so this is like the high quality CPR that should be emphasized more than compared to that of the multiple drugs or airway maneuvers, right? And the next important is early use of AED. Right, so early use of automated external defibrillator. So even in case of the pediatric cases, right, so even in pediatric cases, the early use of AED is very, very important. And next is this TTM, that is targeted temperature management. So targeted temperature management, TTM included in the post cardiac arrest care. So in the post cardiac arrest care, so what is the temperature that has to be maintained is what we have discussed. In case of the post cardiac arrest care, the targeted temperature management should be around 32 to 36 degrees centigrade for nearly around 24 hours, right? And then we have like maternal CPR, like where you need to do a left lateral tilt and early perimortem cesarean is required, that is maternal CPR. And next, very important is in case of drowning victims. Right, so in case of drowning victims. So in case of drowning victims, you need to prioritize the rescue breathing and full CPR. Okay, so first rescue breathing should be given in this individual, right, in patients with the drowning victims. and prioritize the rescue breathing, and the full CPR should be given simultaneously, and it is not hands only. So this is what is in case of the drowning victims. Now I'll just give you one important mnemonic of all these guidelines, that is CABS AVED. What does this stands for? So C stands for the compression. So compression is what to be given first. Okay, so it is C, A, and then B. Then followed by that, A stands for airway after compression. Okay, airway after compression, that is A. And B stands for breaths. And this breath should be around 30:2 or 15:2. Then S stands for you need to give early shock, right, where you need to administer the AED immediately. And the word A stands for advanced airway. And when the individual is on the advanced airway, like ETT, then in such case you need to continue the compressions. You should not stop the compressions in between. And V stands for ventilation, right? V stands for ventilation, and then you need to give one breath every 6 seconds, right? One breath every 6 seconds. Then E stands for epinephrine. So if you see the dosage of the epinephrine that I have discussed, first of all you need to give every 3 to 5 minutes depending upon the cardiac response in the post cardiac arrest state. And the drugs which are very important in this scenario is, one is amiodarone, that is mainly to treat the arrhythmias, and the other alternative molecule is the lignocaine. Okay, so this is what is the treatment, this is what is the nutshell of this CPR. I'll just quickly recap the guidelines. So if you see the CPR sequence, it is CAB, right? Start with compression, airway, and then breathing. The compression rate, it should be around 100 to 120 per minute. And the compression depth in adults, it is around 2 inches, maximum 2.4 inches. Whereas in children, it is 2 inches, and infants, it is 1.5 inches. And if you see the chest recoil, you need to allow the complete recoil after each compression. And you need to give a pause of less than 10 seconds for rhythm check or for shock delivery. And if you take compression to ventilation ratio, without advanced therapy, in adults, the compression to ventilation ratio is around 30:2, whereas in children or infants, in 2 rescuers, it is around 15:2. And with advanced airway, you need to continue the compressions, and you should give one breath every 6 seconds. You should not give any interruptions to the compressions, if at all, if the individual is on advanced airway. And defibrillation, like where we need to use the AED as soon as possible and resume the CPR immediately after the shock. And if you take the rescue breaths for apnea but with pulse, one breath every 5 to 6 seconds and 3 to 5 seconds in case of children. In case of rescue breaths for apnea but with pulse, one breath for every 5 to 6 seconds in adults, whereas for one breath for every 3 to 5 seconds in children or the infants. And if you take this advanced airway like ETT and as well as the LMA, you need to provide continuous compressions. Along with that, one breath every 6 seconds, that is 10 breaths per minute. And use of capnography, if you see, you need to target the EtCO2 of more than 10, that indicates the effective CPR. And the drugs which are required to be administered is epinephrine 1 milligram intravenous or intraosseous every 3 to 5 minutes in the cardiac arrest. And followed by that, amiodarone or lidocaine for refractory VT or VF and pulseless VT. And in the post-cardiac arrest state, you need to maintain the saturation of 92 to 98%, and you need to avoid hypoxia and hyperoxia. And the targeted temperature should be around 32 to 36 degrees centigrade for nearly around 24 hours. And if at all, if there is an opioid overdose, you need to administer naloxone if opioid overdose is suspected. And hands-only CPR has to be encouraged for laypersons if untrained or unable to give the rescue breaths. Okay, and the key addition is that like you need to give a good emphasis on the high quality CPR rather than multiple drugs. Early use of AED is very important, particularly in pediatric cases. Targeted temperature in the post-cardiac arrest care is very important, right? And the next is drowning victims, like how is that you will manage. And so this is the table with summary of the CPR new guidelines. Thank you very much.